Families are shelling out more and more cash for health coverage, and some in our state are reaching a breaking point.
Even after raising rates, North Carolina's largest insurer, Blue Cross Blue Shield, is considering getting out of the Affordable Care Act marketplace.
It's a move that would leave thousands of people in our area without health coverage.
WNCN's Michael Highland is here with a closer look at what's behind this problem. Michael.
We talked to a mom today who's seen her bill jump from $1,400 to $2,200 a month in recent years. And even with that increase, Blue Cross Blue Shield is still losing money. Carrie Okino has been trying for months to get her family's health coverage with Blue Cross Blue Shield straightened out. When she goes on the website, it shows her family has 3 policies, none of them right.
And the third covers 2 of my children and myself and my husband, but it lists our 20-year-old son as the subscriber, our 7-year-old daughter is his spouse, my husband and myself as the dependents.
She's among thousands who've had issues like this recently, but it's not the only concern she has. The cost of her family's plan is skyrocketing fast. $800 more a month compared to just 3 years ago.
It's obscene, and I just don't see how the system can sustain itself or how people will be able to afford it. There's nothing affordable about it.
And speaking of affordable, executives at Blue Cross Blue Shield are now considering getting out of the Affordable Care Act marketplace. The company's been losing money on those plans, resulting in a net loss of $50 million in 2014. Rufus Langley has been in the insurance business for decades.
They're getting the good, the bad, and the ugly, and there's some real ugly claims, I'm sure, coming in.
Langley says part of the problem is that the Affordable Care Act did not address underlying costs of health care, such as medication and doctor visits. Is this really sustainable at this point?
No, it's not, because there's nothing else in our economy that's going up that quickly.
As of February 1st, 613,000 people in North Carolina have signed up for coverage in the ACA marketplace. That includes 165,000 in our viewing area. In recent years, Blue Cross Blue Shield has handled most of that business.
That's going to leave a lot of gaps for people that need coverage.
Carrie Okino has run the numbers. Now she wonders whether it's worth keeping her insurance at all.
We'd almost be better off going without insurance and just paying out of pocket. We were just discussing the other day how much we actually utilized in healthcare in the past year, and honestly, it would be cheaper for us to just pay for everything out of pocket.
Blue Cross Blue Shield executives have not made a final decision and say they're doing what they can to stay in the exchange. Rufus Langley points out this could open an opportunity for another insurance provider to step in, but he says that'll be difficult if underlying costs of health care aren't addressed. Sharon?
The soon-to-be president